Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel today we're going to be talking about oral verrucous carcinoma. Let's start. So in today's episode I'm going to be talking about oral verrucous carcinoma, that is a wart-like or a cauliflower-like tumor growth that is usually seen in the oral cavity. The usual forms of oral cancers are oral squamous cell carcinoma. However, verrucous carcinoma is also something that you need to understand. It presents as a white fungating, exophytic growth which looks like a wart or a cauliflower in appearance, which is very locally aggressive and usually does not show much of nodal involvement or metastasis. So this usually happens, the etiological factors include consumption of alcohol, smoking, smokeless tobacco, areca nut, ill-fitting dentures, poor oral hygiene, and also if you are from the poorer background or low socioeconomic strata, because if you don't have enough access to good food quality and water, so it might just cause you this sort of selective nutritional malnourishment, which will cause this kind of selective deficit and can lead to propensity towards oral verrucous carcinoma. On top of that, what you really need to understand is that it usually happens more in males around 6th decade of life, and it shows localized aggressive behavior. Clinically, it is very similar to oral verrucous hyperplasia. However, I have to point out that the only way to distinguish these two is with the help of a microscopic, that is a histopathological examination, where in verrucous hyperplasia you don't see the epithelial infiltration into the connective tissues. However, this happens in the oral verrucous carcinoma, that there is stromal infiltration and there is deeper penetration of the epithelial cells into the lamina propria. The treatment of this includes surgical excision, also can include chemotherapy or radiotherapy. Also carbon dioxide excision also is required. The nodal involvement in this is not so much, and usually distant metastasis is not seen. However, if there is a hybrid verrucous carcinoma, that means that has a component of well differentiated squamous cell carcinoma, you might see some nodal involvement, and it is definitely important that when you're going for any sort of resection or wide excision of the tumor growth, you have to take the uninvolved margins as well as go for elective nodal resection for the adjacent lymph nodes so that it doesn't spread. Now, it has a pretty decent prognosis when it comes to the excision, but its recurrence rate is very high. That's why the proper histopathological examination has to be done while taking the biopsy sample. And on top of that, you have to understand that because of its recurrence rate is very high, you have to go for a very deep incision for the excision of the tumor mass along with unharmed or unaffected margin. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly as I might be busy with patients. Just drop me a message with on WhatsApp with your name, your age, your location, and the common oral health discomfort or complaint that is causing you any sort of pain or discomfort, and then I will get back to you within a couple of days. Please be patient with me, and if you have any queries, doubts, apprehensions, insights or suggestions, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.